Hello and welcome to International Student Connect. This webinar is about disorders that may affect mental wellness. My name is Nawara and I'm the bilingual coordinator of this project. I will guide you through this webinar today. We will be covering the following topics: mental health disorders, four major disorders: anxiety, eating disorder, depression and bipolar disorder, and schizophrenia, substance abuse disorders, and finally, ISC resources. So let's begin. What are mental disorders? Mental disorders comprise a broad range of problems with different symptoms. However, they are generally characterized by some combination of abnormal thoughts, emotions, behavior, and relationships with others. Examples are schizophrenia, depression, intellectual disabilities, and disorders due to drug abuse. Most of these disorders can be successfully treated. Who is at risk? Studies conducted by the World Health Organization indicates that there are several factors that can affect a person's mental health and contribute to mental disorders. These factors include not only individual attributes, such as the ability to manage one's thoughts, emotions, behaviors, and interactions with others, and also social, cultural, economic, and environmental factors such as national policies, social protection, standards of living, working conditions, etc. 70% of mental health problems have their onset during childhood or adolescence. Young people aged 15 to 24 are more likely to experience mental illness and/or substance use disorders than any other age group. 34% of Ontario high school students indicate a moderate to serious level of psychological distress, symptoms of anxiety, and depression. 14% indicate a serious level of psychological distress. Men have higher rates of addiction than women, while women have higher rates of mood and anxiety disorders. Mental and physical health are linked. People with a long-term medical condition such as chronic pain are much more likely to also experience mood disorders. Conversely, people with a mood disorder are at much higher risk of developing a long-term medical condition. People with a mental illness are twice as likely to have a substance use problem compared to the general population. At least 20% of people with a mental illness have a co-occurring substance use problem. For people with schizophrenia, the number may be as high as 50%. Similarly, people with substance use problems are up to 3 times more likely to have a mental illness. More than 15% of people with a substance use problems have a co-occurring mental illness. Canadians in the lowest income group are 3 to 4 times more likely than those in the highest income group to report poor to fair mental health. Studies in various Canadian cities indicate that between 23% and 67% of homeless people report having a mental illness. Understanding mental illness. Mental illnesses can take many forms, just as physical illnesses do. Mental illnesses are still feared and misunderstood by many people, but the fear will disappear as people learn more about them. If you or someone you know has a mental illness, there is good news. All mental illnesses can be treated. In today's webinar, you will learn about mental illnesses, which can also be called psychiatric disorders, and their treatment. You'll also find helpful resources that provide more information to further your understanding of mental illness. Types of mental illnesses. There are several types of mental health disorders. In the interest of time, we will focus on 5 disorders: anxiety, depression and bipolar disorder, eating and obsessive compulsive disorder, as well as schizophrenia. If you need additional information on these disorders, as well as others not listed here, please visit the Canadian Mental Health Association's website at www.cmha.ca. Let's begin with anxiety disorders. We all feel nervous or worried at times. This anxiety can be a helpful feeling when it motivates us or warns us of danger. An anxiety disorder, on the other hand, causes unexpected or unhelpful anxiety that seriously impacts our lives, including how we think, feel, or act. There are several types of anxiety disorder. Let's start with phobias. A phobia is an intense fear around a specific thing like an object, animal, or situation. Most of us are scared of something, but these feelings don't disrupt our lives. With phobias, people change the way they live in order to avoid the feared object or situation. Then there's the panic disorder. Panic disorder involves repeated and unexpected panic attacks. A panic attack is a feeling of sudden and intense fear that lasts for a short period of time. It causes a lot of physical feelings like a racing heart, shortness of breath, or nausea. Panic attacks can be a normal reaction to a stressful situation or a part of other anxiety disorders. With panic disorder, panic attacks seem to happen for no reason. And then there's agoraphobia. Agoraphobia is fear of being in a situation where a person can't escape or find help if they experience a panic attack or other feelings of anxiety. A person with agoraphobia may avoid public places or even avoid leaving their homes. And finally, there's social anxiety disorder. Social anxiety disorder involves intense fear of being embarrassed or evaluated negatively by others. As a result, people avoid social situations. This is more than shyness. It can have a big impact on work or school performance and relationships. Anxiety disorders, who and what? Who do they affect? Anxiety disorders can affect anyone at any age, and they're the most common mental health problem. Sometimes anxiety disorders are triggered by a specific event or stressful life experience. Anxiety disorders may be more likely to occur when we have certain ways of looking at things, like believing that everything must be perfect, or learn unhelpful coping strategies from others. But sometimes there just doesn't seem to be a reason. So, what can I do about them? Many people who experience an anxiety disorder think that they should just be able to get over it on their own. Others may need time to recognize how deeply anxiety affects their lives. However, anxiety disorders are real illnesses that affect a person's well being. It's important to talk to a doctor about mental health concerns. Some physical health conditions cause symptoms of anxiety. A doctor will look at all possible causes of anxiety. Now let's talk about eating disorders. What are eating disorders? When someone has an eating disorder, their weight is the prime focus of their life. They're all consuming preoccupation with calories, grams of fat, exercise, and weight allows them to displace the painful emotions or situations that are at the heart of the problem and gives them a false sense of being in control. There are three main types of eating disorders: anorexia nervosa, bulimia nervosa, and binge eating disorders. Let's start with anorexia nervosa. A person who experiences anorexia nervosa may refuse to keep their weight at a normal body weight. They may do so by restricting the amount of food they eat or exercise much more than usual. They may feel overweight regardless of their actual weight. They may think about their body weight often and use it to measure their self worth. This illness can cause heart and kidney problems, low blood iron, bone loss, digestive problems, low heart rate, low blood pressure, and fertility problems in women. As many as 10% of people who experience anorexia die as a result of health problems or suicide. And then there's bulimia nervosa. Bulimia nervosa involves periods of uncontrollable binge eating, followed by purging, eliminating food such as by vomiting or using laxatives. People who experience bulimia nervosa may feel overweight regardless of their actual weight. They may think about their body weight often and use it to measure their self worth. And this illness can also cause medical issues such as kidney problems, dehydration, and digestive problems. Vomiting often can damage a person's teeth, mouth, and throat. And finally, binge eating disorder. Binge eating disorder involves periods of overeating. People who experience binge eating disorder may feel like they can't control how much they eat and feel distressed, depressed, or guilty after binging. Many people try to keep binging a secret. Binge eating can be a way to cope or find comfort, and it can sometimes develop after dieting. Some people may fast, not eat for a period of time, or diet after periods of binge eating. Binge eating disorder can increase the risk of type 2 diabetes, high blood pressure, or weight concerns. Eating disorders, who and what? Who does it affect? Eating disorders can affect anyone, but some people may be at higher risk. People who experience lower self esteem or poor body image, perfectionism, or difficulties dealing with stress may be more likely to experience an eating disorder. A lack of positive social supports and other important connections may also play a big part. In some cases, eating disorders can go along with other mental illnesses. So, what can I do about them? You may have a lot of difficult feelings around finding help. It isn't always an easy step to take. Many people who experience an eating disorder are scared to go into treatment because they may believe that they will have to gain weight. Eating disorders are treatable and you can recover. A good support team can help you through recovery and teach important skills that last a lifetime. So, what is the treatment option? Medication. While there are no medications specifically for eating disorders, medication may help with the mood problems that often go along with an eating disorder. Now, let's talk about schizophrenia. So, what is schizophrenia? Schizophrenia is a mental illness that affects the way a person understands and interacts with the world around them. At the beginning of an episode, people may feel that things around them seem different or strange. They may start to experience problems concentrating, thinking, or communicating clearly, or taking part in their usual activities. At the height of the episode, people may experience breaks from reality called psychosis. These could be hallucinations, sensations like voices that aren't real, and delusions, strong beliefs that aren't true, like the belief that they have superpowers. If you suffer from this illness, you may also experience changes in mood, motivation, and the ability to complete tasks. After an episode, signs can continue for some time. People may feel restless, withdraw from others, or have a hard time concentrating. Schizophrenia, who and what? Who does it affect? Schizophrenia can affect anyone. It usually starts to affect people in the teen years. Research shows that females often start to experience the illness a little later than males. No one knows exactly what causes schizophrenia or why it can affect people so differently. Genes, the way a person's brain develops, and life events may all play a part. So, what can I do about it? Talk to your doctor. While there's no cure for schizophrenia, people can and do recover. Recovery may mean learning to reduce the impact of problems, work around challenges, or maintain wellness. Most people use some combination of the following treatments and supports. Some people need to spend time in hospital if they experience a severe episode of psychosis. This is a time to figure out the best treatment for you and begin your journey to health. Before you leave the hospital, care providers should help you map out the service providers, like doctors, counselors, and social workers, who will be involved in your care and support your recovery. Medication called antipsychotics may help reduce the severity of symptoms like hallucinations and delusions and may eliminate these symptoms altogether for many people. Continuing medication after you feel well again may help reduce the risk of relapse when symptoms come back. There's also counseling and support. Counseling and help can help with many problems like how mood, anxiety, and relationships. You can learn helpful skills like problem solving and setting goals. There are also therapies to help reduce the impact of delusions and hallucinations. Schizophrenia can affect people's goals around education, work, and independent living. Depression and bipolar disorder. What is depression? Depression is a mental illness that affects a person's mood, the way a person feels. Mood impacts the way people think about themselves, relate to others, and interact with the world around them. Without supports like treatment, depression can last for a long time. And what is a bipolar disorder? Bipolar disorder is another mental illness that affects mood. With bipolar disorder, people experience episodes of depression and episodes of mania. Let's take a look at depression first. Signs of depression include feeling sad, worthless, hopeless, guilty, or anxious a lot of the time. Some feel irritable or angry. People lose interest in things they used to enjoy and may withdraw from others. Depression can make it hard to focus on tasks and remember information. It can be hard to concentrate, to learn new things, or to make decisions. Depression can change the way people eat and sleep, and many people experience physical health problems. Now let's take a look at bipolar disorder. An episode of depression and bipolar disorder is the same as other types of depression. It may be accompanied by mania, which is an unusually high mood for the person. People may feel like their thoughts are racing and may feel hyperactive. They may feel unrealistically confident, happy, or very powerful. Many people don't sleep much when they experience mania. People usually experience periods of wellness between episodes of depression or mania. Episodes of depression or mania generally last for a period of time, though a small number of people may experience episodes that change quickly. Depression and bipolar disorder. Who and what? Who do they affect? Depression and bipolar disorder can affect anyone. They are likely caused by many different factors that work together, including family history, biology, the environment, life experiences, personality, and physical health problems. So, what can I do about it? Depression and bipolar disorder can be very challenging. Many people blame themselves for their feelings or wonder why they can't just get over it. Though they are challenging illnesses, there are several ways to manage these illnesses. Counseling and support. A type of counseling called cognitive behavioral therapy, or CBT, is common for mood disorders. It teaches you how your thoughts, feelings, and behaviors work together. There are also other coping skills involved in CBT. Talk to your doctor about seeing a therapist. There are also support groups. Support groups are also very important. Depression and bipolar disorder can isolate people from others, and isolation can add to mood problems. Support groups are a safe place to share experiences and learn from others. There are medications. Antidepressants are the main kind of medication used to treat depression. Antidepressants may not be the best option for bipolar disorder. Instead, bipolar disorder may be treated with mood stabilizers. So please speak with your doctor to discuss treatment plans. There are other options. If depression is very serious or lasts for a long time, doctors may recommend electroconvulsive therapy or ECT. ECT can be very helpful, especially when other treatments haven't worked. There's also relapse prevention. A big part of recovery is learning to recognize relapse. A relapse is when the symptoms come back. Seeking help as early as possible can do a lot to reduce problems or challenges. Your plan may be a formal arrangement with your care team or an informal plan with loved ones. Are you in crisis? Find help. The Canadian Mental Health Association, CMHA, is the most established, most extensive community mental health organization in Canada. Through a presence in more than 330 communities across every province and one territory, CMHA provides advocacy, programs, and resources that help to prevent mental health problems and illnesses, support recovery and resilience, and enable all Canadians to flourish and thrive. There's also Crisis Services Canada, CSC, evolved out of the Canadian Distress Line Network, CDLN, a national network of existing distress, crisis, and suicide prevention line services that has been engaging members since 2002. They are available 24 hours and 7 days via toll-free phone. There's also Kids Help Phone, which is Canada's only 24/7 helpline. It's a national support service. They offer professional counseling, information referrals, and volunteer led text based support to young people in both English and in French. They can be reached via phone, text, mobile app, or through their website that you can connect with them whenever you want, however you want. Now let's talk about substance abuse disorders. Substance use disorders. It is common for people experiencing mental health problems to use alcohol or drugs to feel better or deal with their symptoms. Substance use disorder includes alcohol abuse or dependence, cannabis abuse or dependence, and other drug abuse or dependence. Using substances like alcohol and other drugs can have an impact on mental health. Also true as mental health can have an impact on substance use. Some people also take prescription drugs for non-medical reasons. For example, students may use drugs to help them stay awake or to relax. This is extremely dangerous and can also lead to addiction. We all have unique problem-solving skills, support systems, and goals. These are just some of the factors that influence how and why people might use alcohol or other drugs. High risk. According to a publication by Statistics Canada, youth had higher rates of substance use disorders than all other age groups. Youth aged between 15 to 24 had the highest rate of substance use disorder. Many people who experience addiction or substance use issues also experience stigma and discrimination. Stigma can be defined as a negative stereotype, and discrimination is the behavior that results from this. The study showed that males had higher rates of substance use disorders over the 12-month study period. Approximately 6.4% of males and 2.5% of females reported symptoms consistent with substance use disorder. While males and females had similar rates of other non-cannabis drug abuse or dependence over the 12-month period, males had higher rates of abuse of or dependence on alcohol and cannabis than did females. That is approximately 4.7% of males and 1.7% of females met the criteria for alcohol abuse or dependence in the past year, and 1.9% of males and 0.7% of females met the criteria for cannabis abuse or dependence. Symptoms and treatment options. If you or someone you know has one or more of the following behaviors, it may be substance use disorder. Constant cravings for the drug or alcohol with continuous use despite the harms that drugs or alcohol is causing, such as negative health effects and get lower grades or marks at school. Heavy use of some drugs and substances don't just affect your brain, it can also damage your physical health and your organs, such as your liver, kidneys, and lungs. Missing school or work. Using substances can affect someone's ability to study, to concentrate in class, and to keep up with assignments. And if someone cannot focus because of their problematic substance use, they might lose their job. People may begin to isolate themselves from friends and family members. Extreme changes in behaviors and mood may also be evident. So, what are the treatment options? There's day treatment, which typically offers the same programming as residential treatment, but clients will go home towards the end of the day instead of staying overnight within the facility. There's also group therapy, which is typically offered within community-based treatment facilities, meetings with individuals who have similar concerns to discuss skills and strategies for managing addiction, substance use issues. There's case management, a process where a person has a worker who is assigned to them for support. This can include developing a treatment plan, linking them to services, and monitoring their progress. And finally, there's residential or inpatient treatment, which is a more intensive treatment where a person stays in a treatment facility 24 hours a day. These programs can last from 21 days to several months. Usually, residential programs will offer group counseling, individual counseling, case management support, and family counseling if requested. These facilities can be either public or privately funded, and wait times for residential treatment may vary. Find help for substance abuse. So, who can help? Professionals with the following credentials can help if they are also trained in addiction treatment: medical doctors, addiction medicine specialists, psychiatrists. If your healthcare professional is not trained in assessing and treating addiction, he or she can refer you to a professional who is. Don't be afraid to ask for a referral from your doctor. There are also addiction therapy and counseling. Therapy and counseling is the most common form of treatment for alcohol and other drug use problems. It can be delivered in many formats, including to individuals, couples, families, and groups. The most common formats are individual therapy, which involves meeting with a therapist or counselor one-on-one, and group therapy, which involves meeting with a therapist or counselor and other clients who share similar problems in a group setting. There are also peer support groups, which provide a safe place where people with alcohol or other drug use problems can support each other. Participating in these groups during treatment and continuing with them after treatment can make transitions easier and offer consistent support throughout the recovery process. These group programs are free in many communities and also online. Although it is not treatment, peer support groups can provide valuable recovery support for individuals both during and after treatment. There are structured treatment programs. These intensive programs have a structured daily schedule of addiction treatment and activities. Treatment can include group and individual therapy, education about symptoms, social skills training, and treatment planning. Look for programs run by a team of qualified addiction and healthcare providers. Addiction medication. There are several addiction medications that can help people who are addicted to alcohol or to other drugs. The most commonly used are medications to treat alcohol addiction and opioid addiction, such as prescription, painkillers, heroin. If using addiction medication, the best results are seen when they are combined with counseling and other supports. Your family doctor can assess if an addiction medication might be helpful for you. Relapse prevention plan. They can reduce both the chance and severity of relapses. A relapse is when a person returns to alcohol or other drug use after a period of not using or of controlled use. A plan can help others understand how to support your recovery and help you get back on track if you have a relapse. Relapse prevention plans are based on an understanding of your alcohol or other drug use, such as previous relapses, triggers, high risk situations, and warning signs, and they include strategies for managing potential pitfalls. There are also more resources that you can find support from. So there's Kids Help Phone's live chat, counseling that lets you connect one-on-one in real time with a Kids Help Phone counselor on the web or from their Always There app. There's Good to Talk, which is a free confidential helpline for post-secondary students in Ontario, ages between 17 and 25. By calling Good to Talk, students can receive information and referrals about services and supports for mental health, addictions, and well-being on and off campus, or speak anonymously with a professional. There's also Connects Ontario, which provide free and confidential health services, information for people experiencing problems with alcohol and drugs, mental illnesses, and issues with gambling. They are funded by the Government of Ontario, and their system navigation and information services is live answer 24 hours a day, 7 days a week, confidential and free. And you can also visit ementalhealth.ca, which is a nonprofit initiative of the Children's Hospital of Eastern Ontario, CHEO, dedicated to improving the mental health of children, youth, and families. If you are looking for information about mental health and where to find help. eMental Health provides anonymous, confidential, and trustworthy information 24 hours a day, 365 days a year. This service is an online service. They're not a direct service provider. If you have any questions, please contact us by phone at 1-844-871-4567, or you can email us at isc@costi.org. Thank you so much for listening. Remember, it is okay to seek help if you or someone you know are experiencing some of the symptoms mentioned in the previous slides. Thank you once again, and have a great day.